Joe, just go over that.
Perfect,
He likes to wing it.
Yes.
But he's good.
Yeah, he's great, yeah. I've seen some of his works.
Phone's on vibrate. Joe go that quick? I said, where did Joe go that quick? That's gonna make sure.
So if he's right, then it should be, the screen should be up now. I'm gonna go take.
Yeah, I just want to make sure he can double check this. Doc, do you need that near you, that mass, anything like that near you?
I don't know if it's something you think it'll come up, because if that's the case, then maybe that should be right here. Let me grab it.
Yeah.
Yeah. Noise, so I'll leave this here. And is there going to be a mic or anything?
It's a shotgun mic right here, Doctor.
Okay, perfect.
And it's picking up everything. It's like really, really sensitive.
Perfect.
Matter of fact,
Even better.
guys coming down. Yeah, because we was talking about miking you up. It was like, we just buzzing up saying.
How that is better, yeah. That way there's less.
Yeah, less touchy.
Yeah, exactly. So how has it changed your guys' life? Obviously, kids at home.
Kids at home,
Yeah.
trying to, people who haven't worked from home before, we're trying to not figure it out, but it's just a little bit of, the communication style is different. And
Right.
getting things done. It's not good for business.
No, it's not.
Advertisers are just.
No, because
Hi everyone, I'm Joe Martucci with the Press of Atlantic City. Joined with me here is Dr. Nina Radcliff. She is an anesthesiologist and our medical contributor here to talk about coronavirus in South Jersey. We're going to be answering your questions as well. Dr. Nina, thank you for being here today. We appreciate it. First question I believe a lot of people have is, what is the difference between the coronavirus and just the regular flu? Because a lot of people, you know, if they're feeling sick, they're getting these flu-like symptoms, and then that can translate over into coronavirus, or at least those symptoms, you know, can pinpoint somebody to have them have coronavirus.
Right. Well, we're in the middle of flu season, and we just, I think, got over the peak, and we're starting to see the tapering off of the flu. So every year the seasonal flu comes around. It's caused by a virus. Coronavirus is also a virus, and what happens is if it infects you, it affects your respiratory system, whether your nose, your mouth, your lungs. And so we can see a lot of the similar symptoms where a fever, shortness of breath, a cough, feeling tired, muscle aches, as well as even diarrhea. So this can be confusing for some. And I'd like to add also it's seasonal allergies at this time. Things are coming into bloom. So we may see a little bit of a sore throat, some sniffles, a cough. And so there's a lot of things that can be confusing. And so it's hard for people to discern what may be going on.
So at what point should a person who is feeling some of these symptoms actually go to their doctor? And what are the steps that somebody would have from going to their doctor to getting tested for coronavirus?
Right. Well, this is unprecedented times, so this is something we're learning. If you feel you have been exposed to coronavirus or you have any of those symptoms, and I want to go over them again, that is a cough, a fever, muscle aches, feeling very tired, I want you to call ahead. Speak to your physician. See what their guidance is, and they can help guide you. If you're having something severe where you're feeling lightheaded or dizzy, go ahead and call them. Let them know ahead of time so they can prepare. They may say, go directly to the emergency room. There's no reason to come in. And they may want to also protect other people around them. Many times people who are infected with coronavirus, they're asymptomatic. They don't have symptoms, or they have very mild symptoms, and it's not necessary to get medical care. And they say that also with the flu. Just because you have the flu, you can have a high fever, there's a lot you can do for yourself, including staying at home and getting that rest. You can treat yourself with acetaminophen, which is commonly known as Tylenol, to decrease the fever. You have to stay hydrated. And if you're unable to do that, that's when you may need medical attention. So please, your doctor's offices may be restricting who's coming to visit. They're still available. Call them to see what needs to be done. You don't have to do this alone. Nobody's saying do this alone, and everybody's charting through uncharted territories. The doctors, the hospitals, everybody, our communities.
Speaking of uncharted territory, I think we can expand that to our vocabulary. Some things have come into popularity, social distancing, self-quarantine, self-isolation. Yes. And I believe the question sometimes people have been wondering, what's the difference between self-isolation and self-quarantine? Is there a difference?
Yes.
And what is it?
Yes, there is. So self-quarantine is when you feel like you've been exposed to coronavirus, and it's done generally in accordance with a healthcare professional. You will stay away from people. You are assuming you have the illness, and you're going to be monitoring for symptoms such as a fever, cough, and after about 14 days, then you can sit there and come out of the self-quarantine. The goal is to assume you have it so you do not spread it to others. Now, self-isolation or social distancing is when you are staying away from people because you don't want to catch it from somebody else. You may have it, but there's not a serious concern. And everybody should be socially isolating themselves.
We're doing it right now.
Yes,
we're 6 feet apart. We measured.
Yes, and we did measure this. And so it's important because no one's ever heard of this before. Epidemiologist, as a physician, I'm aware of it, I learned about it, and we usually practice this type of cautionary behaviors. But for the general public, this is something new, and America will change forever as a result of this. We're understanding what germs are, and that's very difficult to say. How do you believe in something when you can't see it, you can't smell it, it's like an invisible enemy, but it can make you sick. Right. So this is something that people are going to start talking about. I know I've had this discussion with my daughter, what germs are. It's very difficult to explain to an 8-year-old that there's germs here, and we shouldn't be touching this and touching our eyes, our nose, and our mouth. So this is something for children and adults alike that we're going to be more conscious of.
Another thing I believe, with the germs is using hand sanitizer or washing your hands. sometimes I even hear people tell me you should be washing your hands, maybe not use hand sanitizer all the time. Is there a difference? What is the difference between using hand sanitizer and using soap and water?
Well, okay, so there's a difference between cleaning and disinfection. And cleaning is the physical removal of something. So when you put your hands under water, you put soap, and you do it for how long?
20 seconds.
Yes, 20 seconds, and you have to get in between everything. You are physically removing what is on your hands. Now, when you disinfect, you're using a chemical to kill it, not to remove it. You're using to kill it. So when you use a hand sanitizer, we recommend over 60% alcohol. It has to come on your hands. It has to dry. And the drying process is what actually kills the germs. And so there's a difference. The germ is still on you, but it's dead. And if it can't get through either the oils on your hand or something else, it may not kill it. If it's in between, it doesn't get there and it doesn't properly dry, it may not kill it. So it's always preferable to use soap and water, but sometimes it's not feasible. So that's preferable. If you don't, the hand sanitizer is a good second choice.
Got it. Okay, let's turn towards South Jersey, being that we are at the Press of Atlantic City. What have you been seeing here in the area just with coronavirus? Have you seen a general reaction from people down here in this corner of the state that's been different than other parts of the country? Just what has been your experience during your time here in South Jersey over the past couple of weeks?
Well, I'm an optimist, and I like to see the silver lining of this. I've seen our communities come together. Even though church and masses have stopped having mass gatherings it was initially over 50, now it's over 10, I see the churches are reaching out to people. I see people being kinder to one another. Just because we're socially isolated doesn't mean we have to be socially disengaged. And so I know that because we have internet technology, people are reaching out and making phone calls, and they may not have spoken to you, checking to make sure if you're okay. I see communities coming together. So I like to see those types of stuff. But there are people who are scared and they're panicked, and we're having issues. We know the casinos have closed.
Yes.
We know that people may be laid off or are not currently working, and that's very challenging to them. And we're hoping that aid will come soon. We're hoping that we get through this. But I want to remind everybody, this is temporary. This is not life forever. We will be changed because of this, but we're really looking at the next 15 days, and that's a number that media has been talking about. The U.S. Surgeon General has been saying the next 15 days are critical, and that's how we can change the trajectory. Are we going to see a rise in cases that's abrupt and aggressive, or are we going to see a slow increase in cases? And so the next 15 days, if we can do two very important things, maintain hygiene and social distancing, we can really change the course of it. So people see social distancing as a reason to panic. Things are more difficult to attain, whether you're going to the grocery store, and if they see it as panic, that's a problem. I encourage everyone to look at it as a way to have control over what's going on and the trajectory of what's going to happen.
Thank you. And this is a Facebook Live with everybody here in South Jersey and beyond. We are taking some of your questions that were submitted from you over the past couple of minutes while we've been here, and we're going to see if we can take a question right now. So a question that we did have from somebody, is it safe to cook, or is it safe to even do takeout or do delivery, which has been the hot thing to do over the past couple of days since the restaurants are closed?
Yes, we have to eat, so we have to attain food, and we have to prepare it in some form or fashion. In terms of food that we have, we always want to wash our fruit and vegetables properly. That's with soap and water is fine. There's nothing fancy that needs to be done with that. We should always be doing that. When it comes to our meats, we should always be warming them up sufficiently, cooking them thoroughly. We want to keep hygiene when it comes to our washing boards, and this is just in general. Now the concern is, I know there's a lot of questions about what about ordering out and delivery. So there's nothing that Centers for Disease Control and Prevention has stated or put guidelines out about that. Theoretically, coronavirus can exist on cardboard or even plastic for various different times, but we don't know enough about this, and there's nothing in particular that we can go by scientific guidance. If you are concerned about then somebody delivers food, have them leave it outside, leave them the money and their tip on the outside, and then they can ring the doorbell and you can go get it after that. And we always want to wash our hands before we eat. Now I want to
For 20 seconds.
20 seconds, yes. And I always want to remind, coronavirus doesn't get us sick by being on our hand. It gets us sick if it enters into our eyes, our nose, and our mouth, and those are mucous membranes. And if you look at that, these are different types of cells that allow viruses and other germs to enter our body. So those are the entry points. So we have to remember, just because we may touch something, it doesn't necessarily mean it's going to enter into our eyes, nose, and mouth. So definitely before you eat, if you have something delivered, wash your hands. Take precautions.
Any other questions that we do have? We have your questions submitted through our Facebook Live channel at Press of AC. You can find us if you search Press of Atlantic City Facebook. You can find us there. And we welcome everybody watching on our website right now as we talk about the coronavirus in South Jersey. Looks like we have another question coming in shortly. We're here with Dr. Nina Radcliff. Another question we have is, do I need to stay inside? Can you go outside today? And I'm a meteorologist. It's supposed to be in the 70s for much of us here on the mainland, even 60s at the shore. So it seems like a good day to go outside. Can we go outside and should we go outside?
Yes and yes. Social isolation means staying away from people. It means physically separating from one another, trying to maintain at least 6 feet from them, decreasing closeness and contact with one another. It doesn't mean with leaves, with sand, with beach. Now we have to be cautious. If you go to the beach, it doesn't mean when you see somebody, go over there and shake their hands. You can go ahead and go for a nice walk on the beach, and I encourage that. This is a great time to reconnect with nature. I'm a big nature lover. So those of you who may be stuck in an inside job and you're at home, this is a good time to go outside. Enjoy the beauty of nature. It can calm you, can soothe you. It's warm today, and I don't think it's too sunny. You're a meteorologist.
Partly sunny. We'll have some more sunshine as we go into the afternoon.
Yes, you can get some of your vitamin D.
Yes, get some of your vitamin D.
Yes, you can get some of your vitamin D. And so I encourage that. This is a time where we have been asked to pause, to calm down. We can't change what's going around, but we can change how we deal with the time there is. You have this time, you may never have this time again, and go outside, enjoy it. The weather's hopefully be warming up. I think Monday is going to be a little funny for us.
Monday's a little funny. We have a coastal storm coming up, so I think most people are going to want to be inside with
yes.
the rain and temperatures in the 40s. And I just want to clarify on the points you just made. Is that true even for the vulnerable populations? Can they still get outside and enjoy the fresh air? I'm thinking of like my grandparents, right, and they're in their 80s.
Right.
Can they get outside as well?
Absolutely.
Okay.
And again, social distancing means staying away from other people by 6 feet. It doesn't mean not going outside.
Right.
And that has to be very well understood. And I want to get back to the older population,
Sure.
But the whole purpose of social distancing is to decrease the spread, because germs spread from one another with closeness. Again, eyes, nose, mouth, that's the entry points. So if we can separate that, that's important. Most of the time, coronavirus passes from respiratory droplets. When you cough or you sneeze and it goes out and again it falls on eyes, nose, and mouth. And I keep repeating that because it is very important, because if we know how it enters, we can decrease our exposure to it. So we want to definitely social distance. But when it comes to the older population, my parents are older. My mom will kill me if I say how old she is. But
29.
Exactly, and I must be 12. And so when it comes to the older population, that's what we're seeing are having the serious complications and an increased risk of death. Just because you're older doesn't mean if you get it, you are going to pass away or you're going to have a serious complication. And also those who are immune compromised or who have other medical conditions. And this is the same for the flu. Those who have heart disease, those who have lung problems, whether it's asthma, COPD, people who are smokers, that can increase your risk for having a complication from coronavirus. People who have cancer, their immune systems are compromised. People who may have sickle cell or take any type of steroids chronically, either for lupus or some other type of condition, those are the ones who have an increased risk. So you want to be very careful about those. And my parents, I recommended we have socially distanced ourselves. Because I have to work, I am an essential healthcare provider. I come home with the assumption I have coronavirus. We do not exist within 6 feet. We don't even exist more than that, because it's my parents' health is the most important, and they do live with me. So when I come home, I let them know I'm coming home. They leave, I come home, I shower from head to toe, I wash my hair, and when I go in the kitchen, I let them know so that they don't have to be there. After I'm done, I wipe down all the surface and I go back to my room. And this for me is so important. My parents' health is very important.
Sure. We have, as far as the transmission of the coronavirus, question we had is, can you transmit the virus just through clothing? Can it exist on clothing, live on clothing, and be spread just through clothing if you came in contact with it?
And yes, potentially. Just so we understand, again, respiratory droplets is the major way. But if somebody sneezes on a shirt and somebody else comes and touches it and then goes to their eyes, nose, mouth, they can transmit it. We don't know how long it lasts on various surfaces. This is a completely new virus. We're learning a lot about it. There's been some recent reports that have been scientifically proven that it can last in the air for up to 3 hours, but it starts disintegrating. It can last on cardboard for about 24 hours, but it starts disintegrating. And a lot else depends on the humidity. We don't know if humidity affects it. We're assuming it does. Temperature, and other conditions. So we do know over time the virus can't live on its own. It needs our bodies to live and replicate and then be spread again. That's how it works. So we're not completely sure, but this is my recommendation. I go into work in my regular clothes. When I get to work, I put on my scrubs. When I'm done with work, I leave my scrubs at the hospital, put my regular clothes on, and I come home. And so we have to be conscious about this. And at this time, there's a lot of unknowns, so we want to be wary of that. One thing I say, people wearing shoes. You go outside, you have to go get your groceries, you stay socially distant, but you're picking up whatever's on the floor and you're bringing it home. Leave those shoes at the door, in the garage, don't bring them inside. Don't put them on the couch, don't bring them in your bed. So these are new practices that I think that are gonna stick in people's conscience. So, and even the clothes that you may wear outside to work, take them off, put them in the laundry, keep them isolated, wash them. These are things that are at the utmost of precaution.
We're here with Dr. Nina Radcliff, and we're answering your questions through our Facebook page with the Press of Atlantic City. We have another one here that says, can someone with coronavirus, or can someone have coronavirus without symptoms? So can you be asymptomatic to coronavirus? And I want to follow up with another question on top of that is, are there certain populations that are more going to be asymptomatic with this than others?
Yes, okay. So first of all, most cases, and right now the numbers that we have are about 80% are asymptomatic or have mild symptoms. There's also another concept that of an incubation period. And so if, for example, I am exposed to coronavirus and I get sick, it can take up to 14 days for the time that I've been exposed to it from the time I have symptoms, if I do have them at all. And the average time is 5 days. So after being exposed, most people will show symptoms within 5 days. Again, those are fever, muscle aches, cough, even diarrhea. So those are the things that we're looking out for. So many people will be asymptomatic or have mild symptoms. We're not really sure, it's completely new. And as we increase testing, we're gonna see more people who may be tested, who may not have the symptoms or worried about it, will have that. And that's why we're also gonna see an increase in the number of people who've been diagnosed. So when we see these numbers, I urge, don't panic.
Right.
This is expected. We are gonna see an increase in it. The question is, how do we deal with them? Can we slow that down? We have the best healthcare system that the world has ever known. If I had to deal with a pandemic, I wouldn't want to be in any other country in any other time period. And so our healthcare system is an amazing force, and I am proud to be a physician every single day. I know that our healthcare providers are dedicated and they're there, but we need to be able to slow down the number of people who need help. We're finishing off flu season. There's a number of people who are requiring special care for that. Fortunately, that's decreasing, but we need to keep those beds free so that we can, if we have to treat the coronavirus.
Sure. Another question we have, are all South Jersey hospitals prepared to deal with this? And a lot with flattening the curve, to my understanding, is to reduce the amount of demand for the hospital bed. So here in South Jersey, we had our first cases confirmed earlier in the week, and I'm sure we're gonna see more as we go forward. So is South Jersey prepared for this? Are the hospitals prepared?
The hospitals have been preparing for this for some time. We're in the business of health. We're in the business of decreasing the spread of viruses, including the flu season. Every year, I know that my daughter's pediatrician's office, they don't even take regular well visits during flu season because they want to reserve it for those who are the sickest. And so we have been preparing for the flu. Everybody has had to get the flu shot who works in the hospital. We even wear, at my institution, we even wear a little badge saying I got vaccinated. So we've been preparing for this. In terms of that, yes, we are, I actually brought the mask that I was issued for myself, and if I can share that
absolutely,
with
yes. Share it with us.
So when people say, you know, and they read all these things that cause panic, I want to show this is the mask that I received after it was properly fitted. And so I had to go through this whole test. It's called a fit test, and I think I posted that on my Instagram page of what we go through and how we fit the masks. And this is seal-proof, nothing can get in, and this is special filters. And this is what I wear when I take care of patients, and I am putting either breathing tubes or taking care of them for other types of procedures. And the question comes up, should I be wearing a mask? Can I protect myself? It's nice in theory, but it gives a false sense of protection. There's no science to prove it. So we have to be cautious about rumors and myths and misinformation. It doesn't work. Most masks, this is a regular mask that we normally wear, but when it's put on the face, there's space here where things can still enter. So if you're exposed to it, it doesn't work the way that, for example, this mask,
Right.
or even this is called an N95 mask. This was also fitted to my face where it's a proper filter that does that. So again, people who want to wear the mask, it's a false sense of security.
Right.
It can still enter from the side. It's wise if you are sick to put the mask on so you don't spread it to others, but it's not going to keep you safe on your own. And it's been encouraged that there's no reason to buy this and take up supplies that can be used for healthcare providers who
Sure.
are on the front line for that. So that's my little show and tell.
That's perfect. We're taking your questions here with the Press of Atlantic City. We have heard about supply shortages. Do we have any supply shortages here in South Jersey, or are we still okay and good to go on that?
We've had to reevaluate. Again, this is something that we have never seen before. I have not personally had any supply shortages. And that's why we're also asking patients, if you have a surgery that's elective, meaning it's not urgent, it's not emergent, it's not about cancer, it's not something that's going to harm you, delay it if possible. We don't want to, and I think a lot of the hospitals have made this decision not to do elective cases if it's not necessary, because it's going to take up a hospital bed,
Sure.
it's going to take up supplies. So everybody needs to do their part. The hospitals, they're professional, there's teams of people who look at these types of stuff. This isn't just, it happens and we're going to react to it after the fact.
Right.
This is what we do. We're in the business of health.
Where do we go from here? And I want to touch on the weather a little bit, because you did talk about the humidity and the moisture. I have just come across over the past couple of days that the UV can help, destroy coronavirus in the warmer weather. Do we know that for a fact, or is that just we should take some cautious optimism for that?
Yes, cautious optimism.
Okay.
The concept that you're alluding to is called seasonality, seasons. And we generally have seen this with other respiratory viruses like the flu. It starts around October, it peaks around January, February,
Sure.
and it ends around March, April, depending upon which strains are there. And it has to do with, like you said, humidity. It has to do with temperature. It also has to do with how much people are indoors and socially distanced. When it's warm, you want to be outside, you want to be on the beach, you may not be as close quarters with somebody. So those are some of the factors that work when it comes to the flu. We cannot translate that completely to coronavirus. We hope for that. We're optimistic that, because that would be great. It's getting warmer. We
Sure.
may have a reduction in that, but we cannot hope for that. Right now, I want to refocus that the next 15 days are very important. Socially distance yourself, maintain your hygiene, follow these things, follow these recommendations that are being said. We will see a very different course if we do this and the communities come together.
Sure. We have another question here. It says, can preteens visit my house? And we've heard a lot about children and the coronavirus. And I'm imagining, I won't say for sure, I'm imagining it's probably someone older who's asking, can their children or grandchildren visit the house?
And this is a tough one. I know that the children are out of school. They have to be home. Somebody has to watch them.
Yes.
Most of them are too young. I know that you can't just leave them at home by themselves. So who's going to watch them? Many times the grandparents are the ones who chip in. It's hard to find childcare around this time, and people have to work. I have to go to work, and somebody has to watch my daughter. My parents are there, and that's why I'm taking proper precautions. At this time, there are no play dates. And that's difficult to explain to an 8-year-old.
Yes.
That you cannot see your best friend that you grew up with. It's just different because it's hard to explain to children what germs are without getting them scared. And what I try to reiterate to her is that this is just temporary. If there's a birthday party that's coming up, we will have that birthday party, just not right now. And that's very hard when it comes to children. We want them to be entertained, and the president has recommended that social gatherings of less than 10. So it's hard with our freedoms. It depends upon the risk factors. Like I said, my parents are older, and they are at an increased risk of a serious complication. So that's very important to me. So at this time, nobody can come to my home.
Mm-hmm. Someone wants to know, can you get a face rash from coronavirus? Is that a symptom?
That, I can't say it's not a symptom. It's not one of the common symptoms that we've seen or it's
Got it.
been reported. Again, it is a cough. It is a fever. It's extreme tiredness, which is called fatigue. It's muscle aches, and it can be diarrhea. We're seeing more and more of that. So we want to go for the common. So just because you have a face rash, there's still other conditions that can cause it.
Got it. Leave it one more. Someone wants to ask, they have a family trip to Vegas on April 11th. Yes or no?
Ooh. We need to look to guidance from what's going on. Okay, so what's happening right now, from the time we were talking about
Right.
this last week, a lot has changed. Every day there's press conferences and briefings, because that's what our government is doing. They are keeping us informed, and as more information comes in, things will change. So day by day, moment by moment, I say things can be changed. By this afternoon, we may hear something new.
Sure.
We may hear something great, like a vaccine is down, right in the pipelines. We know we're working on that. So things can change. In terms of April 11th, be prepared that it may not happen.
Right.
And the good news is that everybody is being very kind nowadays. I know that the airlines, I had some trips coming up, they have allowed me to cancel without any type of change in fees and stuff. This is a pandemic. America's in this. This is not something new. Weddings are being canceled. Events are being canceled. A lot of decisions are being made for us. So we just have to ride this out. Again, the next 15 days are very important, and we will have to reassess at that time.
Got it. Another question we have is how to tell coronavirus or corona is a cough. I apologize. A cough is from the virus, or is it allergies? So what's the difference between allergies and coronavirus?
And that's a great question.
Yes.
And we don't know. I mean, just because if I were to sneeze right now, it's likely because I have bad allergies, and this is the time of year that that happens. So just because somebody sneezes or coughs, it does not mean that they have coronavirus or the plague or anything else of that sort. It could be allergies, it could be the flu, it could be a common cold that's not coronavirus, it can be a number of different things. Again, we want to look for the symptoms, and a lot of people may be asymptomatic or they may have mild symptoms. But again, if we take the proper steps of hygiene and social distancing and assume that everybody has something and we stay away from them, that's the best method. If you have a high fever, if you're feeling lightheaded, if you pass out, if you're having difficulty, if you have heart disease and your heart's racing, those are things, call your physician, call the emergency room, let them know, and get the care that you need.
We want to thank everybody watching on our Facebook page and our website, pressofac.com. Another question we have here is the impact on pregnant women. Is there a higher risk because of the coronavirus, or vice versa?
Well, we don't know that completely because, again, this is a new virus and we're learning a lot about it. In general, pregnant women have changes in their bodies, including immunological changes, the way we fight germs, and so it's important during this period of time we tell pregnant women when it comes to the flu to be very, very cautious. We recommend that all pregnant women get the flu shot so they can protect not just themselves, but their unborn child. And so the policy I recommend taking is a no regrets policy. Don't do
Telling him that.
Okay. We can get Welcome back, everybody. I am Joe Martucci. We're here at the Press of Atlantic City. Apologize for the small hiccup here. We'll call it our commercial break as we're talking about the coronavirus in South Jersey. We're here with Dr. Nina Radcliff, and the question we had before, Dr. Nina, about pregnancy and the coronavirus. Can we just touch upon that again? Is there any higher risk for people who are pregnant when it comes to the coronavirus?
So just briefly, we said that women change during pregnancy, our bodies change, and our immune system also changes. And there is a big concern when it comes to influenza. So we make sure that pregnant women, they get vaccinated, we make sure that they stay healthy, and we stay safe during that period of time. In terms of coronavirus specifically, we don't know. It's a completely new virus, so we're waiting to see. And when I recommend, if you are pregnant, you want to have the policy of no regrets. Don't do anything that you would regret. And I want to extend that to just everybody in general. If you're older, you have a compromised immune system or some other health problem, no regrets. So we want to be cautious. If you are pregnant, take all the proper precautions. Definitely call your OB. Talk to them if they have any additional recommendations, what you need to be doing. Some people are concerned, should I continue to go to work? Again, that's a personal decision, and you want to talk to your OB about what needs to be done.
Sure. We are taking viewer questions from our Facebook page, Press of Atlantic City. One person does have a question about gloves, using gloves as protection when you're shopping. What kind of gloves should we be looking for, and how helpful are the gloves, since the gloves, I would imagine, are still going to get the virus on, on the glove.
Exactly. And so our hands in and of themselves do not make us sick if coronavirus were to fall on there. We know that because we've said this over and over again. I am happy to say this over and over again because I want people to understand it's when we touch our eyes, our nose, and our mouth. So just because we wear gloves, if we touch our eyes, nose, and mouth wearing gloves, we're still going to get sick. So again, our hands are weapons of mass infection.
Sure.
If you don't wash them commonly. And we should not be touching our eyes, nose, and mouth anytime, really, ever. And I think that this coronavirus is going to change the way our nation looks at our hygiene. So just because you have gloves, there's really no point. If you have a stock of them, if you want to use them, if you're taking in maybe a delivery or something else, you could, but you still have to be cautious with that. So it may provide a false sense of security. And there's a little funny. I had traveled before all the social distancing was. I traveled about, I think, 2 weeks or 3 weeks ago, and the lady on the plane next to me, she offered me wipes to wipe everything. I gladly took it. I wiped. I'm usually pretty good. I have a hand sanitizer that I utilize because planes can be somewhat challenging.
Sure.
So she had the gloves and she's wiping everything and she's doing this and she's doing that. She had her one pair of gloves on. And then she sat there and took her food out and put her gloves into her bag and took her food and sat there and put it directly into her mouth after cleaning and detergents and whatever else she did. And so, again, they can provide a false sense of security, just like the mask. So we still need to be, smart. Like we're going to be asked to make decisions and do things about hygiene and social distancing that they're not black and white, they're gray. So again, if we understand how the virus enters our body, we can make wise choices.
Let's talk about traveling with airplanes. Obviously, air travel has gone way down. There's been restricted travel to some parts of the world. Why is it not safe, or is it, to be on a plane?
Well, let's back up. First
Sure.
of all, the travel ban from China into here was one of the best things that could have been done to decrease the number of people to seed America. Now, coronavirus is here, and at this time, there's areas that have not necessarily been affected. So traveling could introduce coronavirus into areas that weren't previously affected. And that's the concern. Now, there has not been a ban on travel. They're saying non-essential travel, and we are still seeing it. I actually had a flight today, I think it was today, and it got canceled. And I would have canceled it anyways at this time because that was not for an essential need. And so everybody has a choice. Until there's a ban, you are free to travel if the flight still continues. If you do, we have to be common sense. And remember, they don't want anyone really gathered more than 10 people at a time, so you have to keep your social distance of about 6 feet. If you are traveling and have to sit next to somebody, you want to wipe everything down. And so just rethink about it. This is common sense. All of our personal freedoms aren't being taken away. Some decisions will eventually possibly be made for us. We don't know. And that's why these 15 days are important. We're going to be monitoring, everything's on the table. If it means for the betterment of our nation, I could see there be a travel ban. I'm not saying it's gonna happen, I have no inside knowledge of that, but we have to reassess this constantly.
Let's talk about the 15 days. We're a couple days into the 15 days to
Yes.
self-quarantine, self-isolate. Is that enough? Do we know? Is it 15? What is the point of the 15 days, and what happens on day 15?
Right, and that's what I like. I like the number of 15 because it gives something concrete. Because right now we're being told to change the way we live our lives. And it's hard to understand that we will get through this. Every single day is a victory. The 15 days is a number that we want to have a target, but that target can move. But what we do in these next 15 days is crucial, again, to the trajectory. Are we gonna flatten the curve? Are we gonna slow down the number of cases and the people who need to go to the hospital? Or are we gonna sit there and have this peak rise and all these people descend upon our hospitals and there's not enough beds, there's not enough supplies, there's not enough breathing machines. So that's critical. So this is gonna be monitored. So yes, we are a few days in. I would just say today, 15 days until further notice, and they're gonna be reevaluating this constantly. Changes will be made, things will be done, but it's for America.
We have a question from our Facebook page. It says asthma, or she has asthma, and she's coughing with mucus, chest pain, and a low-grade fever.
Okay.
Is that a cause for concern? And maybe this goes back to our allergies versus
Right.
coronavirus.
As an asthmatic, I understand. Call your physician. Call your physician's office. Talk to them. See what you should do. Have guidance. They know you. If you don't have a physician, call the emergency room. Let them know about this, and that way they can expect you if they think you should come in and get treatment. At this time, definitely take care of yourself. If you have a fever and you are not allergic to acetaminophen, which is Tylenol, take that. Continue with your asthma medications until you get guidance, but definitely don't let this fall behind. This could also be the flu. And I know that as an asthmatic, and for me getting the flu, it can really exacerbate it. So we want to be cautious of all things. So just because you cough or sneeze does not mean coronavirus. It could be the flu, it could be another cold, it can be another bug that's causing it, could be the allergies. So, but definitely call your physician's office to get some guidance. If you don't have a physician, call the emergency room, talk to them. They can triage you with some of the symptoms over the phone and provide you some wise counsel.
Would going to an urgent care facility also be a good idea?
It could be.
Okay.
If you don't want to go to the emergency room, understandable, call the urgent care, but definitely call ahead of time. Don't just arrive there.
Right.
Because, for example, even when I arrived here today, we talked a lot about the measures we're going to take so we can stay socially distant and we can be responsible. I called you guys from downstairs and you
Yeah.
let me in.
Sure.
And Buzz, who's over here on the side, he didn't hug me, he didn't shake my hand.
Did you do an elbow?
Nope.
No elbow.
Six
Okay.
feet.
6 feet. Okay.
6 feet. So we acted socially distant to each other. And so you don't want to just go to an urgent care. Yes, but you have to remember, our nurses, our other staff, our doctors are our front line. Even the lady at the front desk or the male at the front desk who's there, they are somebody you can expose to. There's no reason for this. Call them ahead of time so everyone can take proper precautions. If you are not well, you are coughing, you're sneezing, when you get there, they can hand you a mask to decrease the spread to the other people who are there. And people are sick from other things right now. Somebody may have problems with their blood sugars, with diabetes. They may be having chest pain. We don't want to get other people sick. And so life still continues, other illnesses still continue. They're not pausing for coronavirus. They will continue. So we have to be very socially responsible. Call ahead of time. If they feel like they should issue you a mask when you enter or put you in a proper isolation place, that's important. We all have a responsibility.
Dr. Nia, we have a question from our Facebook page that says, does microwaving food kill the virus?
That's an interesting one. I would imagine that, I don't know if it necessarily the waves do, and I can't speak because we don't have any evidence on that. The CDC has not said that microwaving something per se or exposing it to this or that will kill the virus. Warming up food is a good idea for any type of germ because usually at certain temperatures germs can exist. I would imagine that's a good idea for your food anyways, especially if it's been sitting out or something. We need to be conscious. We have to take proper precautions when it comes to food all the time.
Okay. And as we're going forward in time here, so we have our 15 days. If all goes well, do we have an idea of the coronavirus is it going to go away forever? Do we all just kind of become immune to it? Like, what happens? Like, when all the madness is done, what happens to the coronavirus itself?
We just don't know.
We don't know.
We
Okay.
don't know, and there's a few different trajectories that we can see. The next 15 days again are crucial about the trajectory. Coronavirus is here, and it's going to change the way America is, and in terms of our hygiene, in terms of the way we look at illnesses, in terms of the way we look at our health. We see how important it is that our health is there. In terms of coronavirus, we're hoping that as weathers warm up, it may go away, but we don't know that. We're hoping that if you get sick with coronavirus, that you're able to build up the antibodies that you don't get sick with it again. But we don't know that. It may be a temporary immunity where in a year from now you can get sick again. Coronavirus may have a mutation that the antibodies that you have can't fight it. We just don't know. And I wish I had those types of answers, but this is what we have teams of healthcare professionals trying to figure it out. There is some talk about people who've been sick to take their plasma and be able to utilize it to get their antibodies to possibly treat that. So there's a lot of things that are being looked at. So we will have more information as the days come, as the months come.
All right, great. Well, Dr. Nina, thank you so much for being here. We appreciate it. I won't give you a handshake, but we'll say thank you so much. Where can we follow you for any additional information on social media?
On Twitter and on Instagram, it's Dr. Nina, Nina Radcliff, Radcliff. And I'm just putting out tidbits about what needs to be done, what social distancing is, what mitigation means, which is decreasing the spread and the harm, the number of deaths. So I'm constantly talking about things to do. I'm going to start talking about what we do during this period of time. How do we engage ourselves productively? Is it that book we read that we've been wanting to do? Is that organization or spring cleaning that we do? Is it a project, whether it's a painting project? Is it planting a garden? So I'm going to be talking about a lot of those things, and next Monday's article will also be addressing some of the things that we can do while we're socially distancing ourselves. It doesn't mean social disengagement, and I do want to leave with a point. One of the things that the Surgeon General has spoken about is that blood donations are important at this time, and we don't want to socially disengage. So while we are at home and we might be feeling isolated, call your blood donation center if you're healthy. Call them, and if you are you have the ability to donate blood, make an appointment. They are keeping proper techniques. There's something important that we can do with our time right now. Every donation of blood can save up to 3 lives. And as because of the social distancing, blood donations have decreased, and we always have a hard time during flu season. But this is something, you're kind of feeling down, you want to do something for your community, you're not sure what you can do besides just washing your hands and stuff, you can still go and donate blood. It's very important. I had a patient the other day, unrelated to coronavirus, they needed blood. And that blood was life-saving. So if you want to do something productive with your time, this is a great way to do it. Call them ahead of time. You can make an appointment. They are maintaining good sanitation. They're keeping socially distant. They're using proper protective material. And this is a great thing to do for our community. And I encourage you guys to do that.
And there's a Red Cross location right here in Pleasantville where our press headquarters is. So please go ahead and visit there. Well, Dr. Nina, thank you again so much for the time. We appreciate everybody tuning in and asking your questions. I'm Joe Martucci with the Press of Atlantic City. Have a great rest of the day, everybody.